Hello, I'm Jared Diamond. Please join me as we explore the biggest and most interesting questions about us human beings.
Join us tonight at 8 on WEIU.
Serving Paris, Marshall, and Oakland, WEIU, where you can watch, listen, and learn.
Programming on WEIU is made possible in part by
Polly Ice Pizza at 1600 Lincoln Avenue in Charleston. Polly Ice has pizza and spaghetti with dine-in and carry-out. Features include the Polly Ice Special, House Special, and Pancho Villa Pie. Polly Ice 345-3400.
The Fellowship Center, apartment living for low-income seniors and the disabled, offering an independent living center, monthly social activities, and transportation. The Fellowship Center, 301 Lafayette Avenue East, Mattoon.
additional funding provided by the generous support from WEIU members like you. Thank you.
Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Hi, thank you so much for joining us tonight for this special live edition of Being Well. We're live in the WEIU-TV studio this evening, and we're here to answer your calls all about ears, nose, throat, allergies, and all of the things associated with that. So there's a number at the bottom of your screen. That's the number that you can call in this evening, and we have operators standing by in the front office. So if you're concerned that you're going to be on air when you call, you won't be. The operators will take your message and they'll send it down here to me on my cell phone, and I'll ask your question to one of the panel of guests that we have here on the set tonight. We're talking about ears, nose, throat, allergies, hearing loss, lots of different things. And tonight I have Dr. Lori Cadone, an ENT physician with Sarah Bush Lincoln. And I also have Dr. Jennifer Shunk, an audiologist at Sarah Bush Lincoln, and they're here to answer your questions tonight. I want you to know that we are streaming on the website tonight. Well, not on our website, but if you go to our website, weiu.net, in the top right-hand corner, you'll see Facebook and YouTube icons. You can click on both of those, and we're streaming on Facebook, and we're also streaming on YouTube. So you can share this with any friends and family that might be outside of the broadcast viewing area. So let's get started. This is a great time to talk about allergies and ears and nose and throat and all of the different things that come along with symptoms people may have this time of year. So in order to give our viewers kind of an idea of what they can ask, let's talk about different things that you cover in your office. So tell us what an ENT physician actually does.
Well, an ENT physician, the true name for that is an otolaryngologist, and we also do head and neck surgery. So anything pretty much from the shoulders up is covered in our specialty except for the eyes. And that can include things that are pertinent to children as well as adults. We take care of medical conditions as well as surgical conditions. So it's a really wide-ranging specialty.
Okay, so lots of questions can be coming your way.
Absolutely.
Yeah, okay. And Jennifer, what about an audiologist? Tell us what you do.
An audiologist talks about hearing loss. Hearing, we work closely with the ENT physicians, so a lot of our patients are the same. Birth to octogenarians, we deal with all age populations. We do balance studies for patients that are experiencing dizziness. We do hearing testing. We test newborns at the time of birth to make sure that the hearing is there and okay. Hearing aids, that's another hot topic we get a lot of questions from. So basically hearing, all things ears.
All right. So if you have questions that are concerning topics that either an ENT physician or an audiologist covers, that's a little bit about what you can ask tonight. Once again, the phone number is at the bottom of your screen. I want you to call in, talk to one of our operators so I can get your questions answered on air. So I've got a couple questions here that have come in. So what are some common causes of nasal obstruction?
Well, nasal obstruction can be from many different issues. One of the things that are up in the forefront today is allergies. A lot of people are beginning to experience symptoms of allergies because of the upcoming spring. You know, things are getting warm now, and so we're going to see a lot of pollinating of the trees and later on grasses. And so if you have trouble with allergies, those folks are going to have some trouble with obstruction. The nose is meant to warm and moisten the air, and the way it does that is by bringing blood flow to the nose. And that blood that comes to the nose is what makes things nice and warm so that when the air goes down into your lungs, it's not a big shocker. Well, if you have a lot of inflammation, inflammation also causes increased blood flow, and so there's plenty of spaces for that blood to go, and it just blocks up the nose. Outside of allergies, there are things called nasal polyps. Some people have trouble with those. Those are collections of fluid underneath the lining of the nose, and that can be caused by allergies. There are growths that can grow in the nose that can cause obstruction. Septal deviation, the division between the right and left-hand sides of the nose, if that's off to one side or the other, can cause trouble with airflow.
Okay, so if somebody has allergy issues, say some of this nasal obstruction with allergies this time of year or in the fall, you know, there's lots of things flying around in the air that you breathe in that time of year, dust and all those good things. How do they know that it's allergies or a common cold? I mean, how do you know the difference?
Well, sometimes that can be tough, even for us when a patient comes into the office. It may not be crystal clear whether it's a cold or an allergen problem. If you have the same symptoms every spring, the likelihood that it's an allergy is a little bit higher. If it's short-lived, 10 days to 2 weeks and it goes away, then maybe that was an upper respiratory infection, a cold, a virus, that type of thing.
Okay.
So.
And you treat those types of things as well?
Most of the colds and viruses they kind of take care of themselves. You just try and make yourself comfortable, make sure you drink plenty of fluids, get plenty of rest, and they will resolve on their own.
Okay. All right, let's talk a little bit. I may bounce back and forth a little bit here. Is all hearing loss the same?
No, absolutely not. There's three basic categories of hearing loss. There's sensory neural hearing loss, which is the most common. That's nerve damage. That's nothing causing the hearing loss in the middle ear space. When there's a hearing loss in the middle ear space, that's called a conductive hearing loss. That's when we send our patients to see the ear specialists. That would be ear infection. That would be fluid behind the eardrum. That would be a tumor growing in the middle ear space. It could be a foreign body. A kid put a bean or something in the ear. Don't do that, kids. So there's a third, which is a combination of the two types of hearing loss. So if you've got middle ear involvement, a conductive component, and you have nerve damage, then that's called a mixed hearing loss. What we typically see is all of them. So a lot of times we'll see kids with ear infections, we'll see adults with ear infections. A lot of my day is spent with nerve damage type of hearing loss, patients that as they get older they're not hearing as well. So we treat all kinds.
So what is a reason that a nerve in your ear would get damaged?
There's three main causes for hearing loss, and that would be age, genetics, and noise damage. So sometimes genetically you're just predisposed because of a family history. Sometimes you've worked around a lot of noise, hunting, shooting, woodworking, factory work, military service, all of those things. If you're not rock concerts, if you're not wearing adequate protection, you're putting yourself at risk for nerve damage. And then as we get older, everything kind of wears out, and hearing is one of those things as well. So.
Okay. I want to remind all of our viewers at home that if you do have a question, we're here to answer your questions live on air. Once again, I have Dr. Lori Cudone, an ENT with Sarah Bush Lincoln Hospital, and I have Dr. Jennifer Shunk, an audiologist. So if you have questions, please feel free to call us. The number is at the bottom of your screen, and we have operators standing by. So let's see, here's another question. Do both ears have the same hearing loss? Well, if not all ears have the same hearing loss, what makes the difference between one ear and the other? Is there any
Both
certain
ears
cause?
should work the same. Okay. Should. Sometimes there's a tumor growing on the nerve, and that would cause an asymmetrical hearing loss. You could have a noise-induced hearing loss. An example would be gunfire. A lot of times if you're a right-handed shooter, you have left-sided hearing loss because that shoulder will protect that right ear a little bit. So there's lots of reasons to have an asymmetry, but that's not typically what you want to see.
Okay. Is there a difference in ear protection devices versus, you know, the little foam things that go in your ear, or the headsets that you wear over your ears? Is there a better device?
You want to look at, the packaging will always have an NRR, which stands for a noise reduction rating. The higher the number, the more effective that plug or that device is in protecting your hearing. The best plugs out there are those little foam ones that you squish up in your hands. Now, I won't lie, when I see patients using those out and about, they're not inserted correctly. To get the noise reduction rating that they advertise, you really have to squish that down, put it down in your ear, hold it, let it expand, and then when you look at yourself in the mirror, you should not be able to see it. You should be able to run your finger here and not feel it. Okay. And a lot of patients don't put them in correctly. Yeah. But we make custom plugs. They're out there. There's the little triple flange kind that you can get. A lot of factories use those because they're disposable and easy to insert. You can get the circumoral, which are big ones that go over the top of the ear. So there's a lot of different things out there, but if you have to shout to be heard, you should have earplugs in.
And how will they know? Does somebody have to call them out and say, you're kind of talking loud? Have you had your ears I mean, how do you tell somebody if they don't recognize it themselves? Because if their hearing is, you know, going, maybe they don't realize.
You don't. You don't. Hearing loss is very, it's just one of those things that you don't recognize as it starts to get poorer. You know, when you can't see, you know you can't see. When you can't hear, it doesn't affect you, it affects the people that communicate with you. Right. So oftentimes I ask patients, are you here, or did your spouse or family member drag you in here? Because that's a telltale sign. You know, if your spouse is dragging you in, it's affecting them. They're having to shout or repeat themselves a lot. So a lot of times patients don't recognize their own hearing loss. Family members do. Right,
and it's nothing to be embarrassed about, you know. It could be caused by a number of different things, just like you were saying.
I think hearing loss is more embarrassing when you don't do something about it, because then, you know, I always ask patients, how is hearing loss affecting your life? And, you know, I say, did you used to go to church and you don't anymore because you can't hear? Are you the person that's in the corner of the family gathering and not participating? Do you laugh when everybody else does just to fit in? Those are signs that hearing loss is affecting you. And when you start to withdraw, that's affecting, you know, your social aspect of your life, and it's disheartening to see.
Absolutely.
And hearing loss not only affects the person's ability to interact with who they're with, but it is correlated with depression. So if you have someone who has hearing loss and they're withdrawing from family and friends, and they can no longer do the things that they used to do because they can't function in those situations, they can really suffer from depression.
Yeah, that's exactly what I was thinking when you were talking about that, is that's a sad situation to be in, especially if you did have great hearing and then, you know, you don't have such great hearing anymore, and then it would be a sad state to be in. But there's things that we can talk about tonight and ways to improve your life and to deal with those situations. What causes sinusitis, and what is it, and how is it treated?
Okay, so sinusitis is overused. There's a difference between the sinuses and the nose.
Okay.
Most people, when they come into my office and they're talking about sinusitis or I have a sinus infection, most of the time it has to do with nasal obstruction and congestion, not really sinusitis. The sinuses are air spaces in the skull. If our skull was one big solid piece of bone, we wouldn't be able to stand upright. And so what has happened is some of those spaces in the skull are now filled with air. And those air spaces are lined with a mucous membrane. Those are our sinuses. And often the people that are having most trouble are not really having trouble with their sinuses, they're having trouble with nasal congestion.
Okay.
But when you do have sinusitis, it can be devastating. There are problems with being able to function. You know, you've got somebody who's got a true acute sinusitis, they're sick. They have a fever, they not only have a runny nose, but they have discharge that is not like a cold. It's not clear, it's not runny, it's very thick and different than what you would see with just a runny nose or a cold. Some people come into the office thinking they have sinusitis when really what it is just but is a headache. Migraine can often mimic sinusitis. People will complain of pain up above the eyes and below the eyes and talk about nasal congestion. And that can be a type of migraine, not necessarily sinusitis. So oftentimes people are misdiagnosed. And the way that we have to truly diagnose a sinusitis is to send them for a CT scan in order to look at the spaces to see if they're involved with inflammation.
Okay. We had a question come in. Whoever feels best to answer this, feel free to jump on in. This is Molly from Danville. She would like to know if there are any neuroprotective supplements that can help with nerve damage to the ears.
Go get them, Tiger.
Well, I do know that there is some research going on with the federal government because people that are in the military service are often exposed to loud noises frequently. I don't think they have finished with that research, so I don't know that I could recommend any type of supplement to help. Really, the best thing you can do is to protect your ears from loud noises. And if you do have hearing loss, noise exposure is cumulative. So if you have any type of hearing loss, you need to be very, very careful with your ears from that point on, because anything you're exposed to will just add to your hearing loss.
Okay. And once you've lost it, it's not, you can't reverse it.
Sensory neural hearing loss, yes.
Okay. Nerve damage.
Nerve damage. Okay. All right. Keep calling in with those questions. That was a great question, Molly. I hope we answered that for you. Once again, the number is at the bottom of your screen, and we're here live answering your questions, and our operators are standing by. And once again, we are streaming on Facebook and YouTube, so go to our website, weiu.net, and click on the social media links, and you can share it with your friends and family. So let's go on to, we had another question call in just a second ago. Are there surgical options for curing sleep apnea? That's something we haven't covered yet.
The gold standard for sleep apnea is a CPAP. That's the machine that you see with either the full face mask or over the nose to help the person breathe during the night. There are surgical procedures that can be done to help use the CPAP better. If you have severe sleep apnea and you need a lot of pressure to get that air in, sometimes we can do things to help the air get in a little bit easier. But surgical procedures for sleep apnea are not usually curative.
Okay. Let's talk about what sleep apnea actually is, because some people may say, is it when I stop breathing? Is it when I snore loudly? Let's talk about exactly what it is.
So sleep apnea can either be central or can be obstructive. Sleep apnea that's central means that your brain stops giving you signals to breathe. And that is not usually what people are talking about when they talk about sleep apnea. What they're talking about is the obstructive sleep apnea. Obstructive sleep apnea means that when we go to sleep, the muscles of the neck, the muscles of the throat all relax. You know, everything kind of relaxes. And sometimes in some folks that musculature relaxes so much that it just closes up. And when that happens, you can no longer get the air through as well. Either it slows down or it stops completely. And your oxygen level starts to drop. When it drops low enough, your brain says, whoa, what's going on here? And wakes you back up. And that's when you hear the person next to you snoring, 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 and then it gets quiet, and then all of a sudden you hear and that's when they're waking up. So those people don't get a good night's sleep because they get into the deep sleep that's restorative, then they obstruct and they wake up again. So they do this all night long. So what the CPAP does is it puts pressure in and it spreads that stuff that has relaxed and collapsed on itself apart so that the air can get in and out.
Okay, thank you for answering that. That was going to be my next question. We have another question coming in from Judy from Sullivan. She has had thumping in her right ear that started before Christmas and lasted about 2.5 months. She did see a doctor, but they weren't very helpful. She wanted to know if you had an idea on what this could be, thumping in her right ear that's been going on since before Christmas.
There's so many questions I want answers to be able to address her main question. You know, has she had a hearing test? Did she see an ear physician, or did she just touch base with her primary? Did she have a change in medication? Was she exposed to some harmful noise, that it was something that caused that? Is she under particular stress or duress? Is she not sleeping well? Did she have a load of caffeine? Because caffeine can impact that. Sodium can impact that. And not just table salt. Processed foods often aggravate. You know, what she's describing is pronounced tinnitus or tinnitus. Either way is correct. And it can be described as a pulsing, often a high-pitched kind of ringing, like a cricket. Sometimes people will say it's like a seashell in their ear, or a buzzing, or a humming. So there's just so many questions I need answered before I can help her answer her question. Do you have anything to add or defer?
The other thing you want to make sure of is that this isn't due to high blood pressure, that you've had an increase in blood pressure, and that's what's causing the thumping. You're hearing your own heartbeat in your ear. Also, weight change, either gain or loss. If you have a really significant weight loss, all the fat that was around there insulating that noise is now gone, and so now you have a different sound of what's going on inside your own body because of the way it's transmitted.
Okay. With the people who are calling in asking questions, should they see their primary physician first? Do both of you need a referral to see an audiologist or an ENT? What's the best route for them to find some of these answers, you know, where they can get these questions asked? Do they see their primary first, or what would you suggest?
I think that's usually the best route, is to go to the physician who takes care of you and knows you and can help you decide whether this is something that needs further inspection. They don't necessarily need a referral to me, but that it's usually good to make sure that your primary care has a hand in what's going on.
Okay.
It depends on insurances for audiology. Typically, for insurance to cover hearing testing, we need a referral from your primary. Not always the case, but typically.
Okay. All right. We have another, well, I've gotten 2 questions in so far here. Weldon from Sullivan is wondering what he can do about fluid in his ears.
It really is dependent on why the fluid is there. Okay. That's the bottom line. Somebody who has allergies can have problems with fluid in their ears. There's something called the eustachian tube that helps to equalize the pressure in the middle ear, the same thing Dr. Shunk was talking about before, the middle ear. If that's not working correctly, then sometimes you'll have fluid that isn't drained correctly. So it really is dependent on what's causing the fluid.
Causing it. Okay, get to the bottom of that, and then you can figure out how to treat it. All right, let's see. Tim in Charleston would like to know, are there any new treatments for severe tree nut allergies? Would that be a question either of you can answer?
Don't eat tree nuts. I know that's not what he was looking for.
Probably not.
Yeah, probably not. Allergies for food can be very dangerous. And if you are truly severely allergic, then you really need to be careful to avoid those foods. A medical allergist, an immunologist who does food allergy testing would be somebody that might be able to help with that, depending on how severe the allergies were.
Okay, thank you for that. Bob from Terre Haute asks, what do you do about, I don't know if I'm going to say it right, is it tinnitus? Okay, what do you do about that? And what is it? Explain what it is.
Tinnitus or tinnitus is a ringing or a buzzing, an unnatural sound in the ear that the person perceives but nobody else hears, typically. I don't know that there's a cure for it, depending on the cause. You kind of have to figure out if it's noise-induced, like I said, if it's medication-induced, blood pressure, all the things I mentioned before, salt intake, stress, sleep, caffeine, all of those things can impact it. I don't know that there's a cure if it's noise-induced. You know, a lot of times we'll have a patient that has hearing loss and has ringing in the ears that go with it. If they're a candidate for amplification, most people, not everybody, but most people putting a hearing aid on an ear that rings, it'll mask it.
Okay.
During their waking hours. When they take it off to sleep at night, guess what? That ringing is back, but it does give patients relief, you know, during their waking hours, if it's noise-induced.
Okay. Thank you. Another question. I work out on a regular basis and listen to music with earbuds. Can this damage my ears and lead to hearing loss? You see people walking all the time with earbuds in their ears, so what's coming from all of that? Is there any damage or hearing loss?
Oh yes. Again, if you have to, if I'm sitting next to you and you have earbuds in your ear and I can clearly hear that you're listening to music or a podcast, that's too loud. There are noise limiting earbuds now, so if you're a person that is a power junkie and you crank that volume, you may invest in some noise limiting earbuds just to take that control away from yourself. But yes, there's lots of research out there. We're seeing college age kids that are showing up with hearing loss because of earbuds, because of listening to music and podcasts too loud.
Okay, so hearing loss is coming in younger folks now more so than maybe we would have seen in the past. Is it on the rise then?
I think so. I see a lot of people in their early 30s with nerve damage, hearing loss, and I can't say that it's from earbuds, but it's from noise damage somewhere.
Right.
You know, if you go out back and you shoot with your buddies, put some noise protection on. A lot of people don't, because in your youth you're invincible.
Right. Or it doesn't look cool.
Right. Yeah, I always tell people, be a dork, put the earplugs in. But same thing with earbuds. I think it's kind of a silent hearing killer, because you don't think about it.
Right. Okay. Another question, are there any side effects to using nasal allergy sprays on a daily basis?
Well, it really depends on what spray we're talking about.
Okay.
There are medications that are over the counter that can be very dangerous for use over the long term. Using a nasal decongestant for any more than 3 to 5 days can cause dependency on that medication. you have to use the medicine more frequently, and the people that get in trouble have a tendency to use it much more than recommended on the instructions of the bottle. It can cause something called rhinitis medicamentosa, and that's when you are dependent on that spray. You stop using it, and then all of a sudden your nose will swell because it's so used to being held back by that spray.
Now that feels uncomfortable.
Well, and it can make it difficult to treat things like allergies, because we not only have to overcome the symptoms of the allergy, but now we have to overcome the effects of that medicine. And the recommendation for that is to stop using it. It can be a long few weeks when you come off of one of those medicines that you've been overusing. Now, steroid nose spray, like that's out there, that has to be used every day. You can't just use it here and there. Okay. It takes up to 2 weeks to work, so you have to use it every day. Because what happens is when you squirt that stuff in your nose, some of it gets absorbed into the lining, and so part of the medicine gets absorbed. You have a little bit of concentration, next day a little bit more, a little bit more. You have to get way up here for that medicine to be effective. So it takes time to get up there, and then you have to keep applying it to stay at that concentration. Okay. So.
And I find a lot of patients give up too soon. Because they'll see you, and then they'll come to me for follow-up for something different and say, oh yeah, I quit using it, it didn't work. And I say, how long have you been using it? Because I'm pretty sure the recommendation is more long-term than a few days.
I recommend those medications be used at least for a month before you give up and say that they're not working. But they do have side effects too. You can have nosebleeds. Those are medications that can cause bleeding from the nose. That's cause excessive dryness, and if your nose gets too dry, it'll swell. So it's kind of backwards. You'd think if your nose is dry, it would be easy to breathe through, but your nose is supposed to be wet, and when it gets dry, it doesn't like it.
Right. So you got to find the balance.
Yes.
Difficult sometimes. I have another question that came in. How do you know when to get tubes put in your children's ears? So we're switching topics here a little bit. Let's talk about not only when to get them, but what they are, and sort of a little bit about that discussion with children's and tubes.
Okay. In order for you to hear, there are 3 sections of the ear. There's the outer ear, there's the middle ear, and then there's the inner ear. The outer ear is your ear canal up to your eardrum, and between the eardrum and the bone of your skull is the middle ear. That's where we have the 3 little bones that help to connect the eardrum to the inner ear, which is where the nerve is. And what has to happen for the sound to get from the outer ear to the inner ear is that eardrum has to be able to wobble. When it wobbles, it changes the position of the bones, and the sound is transmitted into the inner ear. If you have ear infections, that middle ear space is filled with fluid. Instead of being able to wobble, there's an obstruction, and so the eardrum can't move. When children are little, their heads and ears are a little bit different than the adult. That little tube that brings air into the middle ear space in children is sometimes flat. In you and I, they're angled down so that the muscles that work that tube and open and close it work better, they drain better. So in young children, sometimes their middle ear function doesn't work well, and so they end up with either a lot of fluid back there or recurrent infections. And so what a tube does is we make a little hole in the eardrum, and we bring air in through the eardrum instead of back through the eustachian tube. And those tubes are temporary. They fall out by themselves. The eardrum usually heals up normally. And sometimes you need more than one set. Sometimes you just need one set. The recommendation for whether or not a child needs tubes is either 4 infections in 6 months or 3 continuous months of fluid that never goes away.
Okay. All right. Good answer. Thank you. Along that, we have, at what point would my child benefit from a tonsillectomy and adenoidectomy?
Well, again, there are several reasons. In if we want to talk about the child that has ear infections, sometimes the adenoids can get in the way of that eustachian tube. And so in some children, not only do we put in tubes, but we also take out the adenoids to get them out of the way so that things work better.
Can you explain what adenoids actually are?
Adenoids are a defensive mechanism that is in the back of the nose. You can't see them. People come in and say, you know, I have big adenoids. Well, you can't see them, so no one really knows for sure unless we take a scope and look through the nose whether or not they're big. They are up back behind the soft palate, and they are the same kind of tissue that you find in the tonsils. Okay. They are made of lymphocytes, which are a type of white blood cell that defends against bacteria and viruses. The reason that we would take out tonsils, again, there's a bunch of different reasons. One would be recurrent infections, someone who has tonsillitis over and over and over again. And again, there are numbers for that too. Everybody's got numbers. In tonsillectomy, for a tonsillectomy, the numbers that are recommended are 7 infections in a year, which is a lot of infections.
Yeah, that's a lot.
Or 5 infections in 2 years consecutive, so 10 infections over those 2 years, or 3 infections in 3 consecutive years. Okay. So, also in children, sometimes the tonsils and adenoids are taken out because they don't breathe well at night. Snoring with obstruction, a little bit different than adult obstructive sleep apnea, but similar. The tonsils get in the way when they relax and they stop breathing and they wake up. And they go through that same cycle as an adult. The recommendations for a child who has observed obstructive sleep apnea is to take out the tonsils and adenoids.
Okay, thank you. Let's see here. Let's ask the question, what causes my hoarseness? And I know you're going to have lots of questions about, you know, I've got questions I want to ask, but let's talk about what causes hoarseness, maybe some different types, and maybe some things that can be done about that.
Well, hoarseness can be because of an infection, laryngitis. People that have severe or uncontrolled reflux, indigestion, stomach acid coming up, and splashing onto the vocal cords can cause inflammation and hoarseness. Head and neck cancer, cancer of the vocal cords can cause hoarseness. Anyone who has hoarseness for more than 4 to 6 weeks and it doesn't go away should be seen initially probably by their primary care, and then if they don't resolve, then someone needs to take a look and see what's going on down there.
Okay. Another question came in, how can I prevent earwax buildup? Lisa would like to know.
Oh, there's so many different ways. You have to figure out what type of earwax your body creates, because everybody makes a different kind. A lot of people are Q-tippers. Those are people that Q-tip every single day. That's not necessarily a good behavior. You want to remove earwax from the outer ear, not push it in closer to the eardrum, because then it makes her job harder in terms of getting that out. But you know, there's lots of different ways to manage earwax. Typically, if you clean it too much, your body goes into overdrive and makes more. Earwax is your body's natural lotion for your ear, so if you didn't have any, you'd itch like crazy in there. So a lot of times we see itchy ears, and it's because you're removing too much every day. In terms of management, there's over-the-counter solutions. Typically, they're a oil and a peroxide-based type of solution. Your primary care physician can help you manage it. ENTs can help you manage it if it needs to be managed. People think wax is gross, but it's actually pretty healthy. It protects your ear from foreign bodies and yucky things from getting in there, so you want some.
Okay. How do I know what hearing aid is right for me? So there's lots of different kinds out on the market today, I'm guessing. So let's just talk about hearing devices a little bit and help people know when and what kind to get.
Okay, back to the original concept of how is hearing loss affecting your life kind of answers whether or not you're a candidate. And a lot of people are in denial for a long time So you kind of have to grasp that and overcome that. Come in, we'll assess hearing, look at what your hearing loss is and make sure it's a nerve type of damage that can be helped by a device. One of the big misconceptions about hearing aids is that it fixes the hearing loss. It doesn't fix it. It amplifies the sound so that your brain can process it and use it more effectively. But it doesn't make you hear like you did when you were 10 years old. It does not fix cognitive decline or your brain's ability to understand. For some people, it does a better job than others. But I have a lot of patients that say, you know, I can hear you, honey, but I can't understand what you're saying. And that may be more of a processing issue than an actual sound or a hearing loss issue. In terms of what type of hearing aid is the best choice for you is a cosmetic choice. What it looks like is often like picking out the color on a car. You know, what do you want it to look like? A lot of people don't want it to be seen, so they choose something that's discreet or very small. Most of them anymore will pair using the Bluetooth to smartphones and devices, so you can make and take phone calls through your hearing aids.
Really, they offer that these days. Isn't that interesting?
Then you're hands-free, so
I bet that's something a lot of people didn't know about.
Oh yeah, they're app-driven now, so you can download an app from that manufacturer and make different changes for volume, programming scenarios for different environmental situations. So there's lots of different choices, lots of options in terms of what type is right for you. We kind of go through that when we talk to you about what's out there, what's available, what you can manage, what you're scared of, those kinds of things.
Okay, that's interesting. I had no idea. Technology is awesome. Molly from Danville called again and has another question about hearing. When you experience hearing loss due to family history, is it due to DNA? And are there any DNA repair supplements that would be good to take? Family history and DNA and hearing loss.
I don't know of a supplement to take for, you know.
No, nothing that can repair the damage that takes place over time. And when we talk about family history, it does have to do with DNA. It has to, but it can be DNA differences across many different areas. It can be the ability to sense sound. It can be the ability to process sound. So if you have some issues with cognitive impairment, some of the hearing loss can be due to that as well.
Okay. Got a question about snoring, something that probably affects a lot of people's lives, maybe a lot of couples. What can be done about my snoring? Not my snoring. No. I don't snore. That's what most people say, right?
You don't know you snore.
No. Yeah.
Well, so snoring is vibration in the airway when you're sleeping, and depending on what's vibrating, that can affect where the snoring's coming from. The soft palate vibrates. If you have tonsils, they can vibrate. If you're overweight, you have a tendency to snore more because there's less room, more width of the tissue where the fat's located. So if you lose some weight, sometimes that can help. There are procedures that can be done to help snoring. If the palate is what is vibrating, we can trim the palate a little bit so that it doesn't vibrate quite so much. If you have large tonsils, we can take the tonsils out. Sometimes those procedures will help for a while and then they don't help anymore. As we get older, everything isn't as tight as it used to be, so things get a little bit more flabbier. And so there are some procedures that tighten up the palate. So,
is it true that if folks sleep on their side or if they sleep elevated, can that help with snoring, or does it really not matter?
It really has to do with the position of whatever is flapping around and making all that noise.
Okay.
So if when you lay on your back, your palate falls backwards. So then when you breathe, that's going to flap more than if you're on your side. The palate isn't obstructing the airway quite as much.
All right. How often should I have my hearing aids checked?
That just depends on you. Typically, we like to see hearing aid patients at least once a year. just to make sure everything's up to date and working well. Some people have a more aggressive earwax and they need to be more thoroughly cleaned more frequently. Some patients have a change in hearing, so they need to come in sooner than that annual check. But as a general rule of thumb, I'd say annually.
Annually? Is there maintenance that they need to do on their own at home throughout the year?
Absolutely.
And what would that be?
Part of that, you know, when you're fit with a device, we show you how to take care of it, what to do, what not to do. It depends on the type of hearing aid that you're wearing, but typically you need to watch for wax building up skin. You need to keep the microphone ports clear, the receiver clear, those types of things. So kind of like you take care of anything else, you want to make sure it's not getting grungy.
Okay.
I mean,
right. How long do hearing aids typically last? Is there an average?
Oh gosh, that changes all the time. You know, you talk to some people and they'll say 3 years. I think that's a little crazy. I'd say 5 to 7 years is a good number, not because of durability per se, but more because of technology advancements. You know, just within the last couple of years, here's Bluetooth. So some patients are replacing devices sooner because they want that technology. Some patients, they don't hear as well as they did when they first got that one. So, you know, the new chips are constantly processing faster than their predecessor, so they pursue it quicker. But they're expensive little buggers, so some people kind of ride them out a little bit longer. Good rule of thumb is 5 to 7 years.
All right. Another question, Dale from Tuscola asks, can you use a saline solution for your nose too much? We talked about the nasal decongestants earlier. What about saline solution?
Saline is a little bit safer. It really isn't a medication, it's just a salt solution. And really what that helps to do is to replace the moisture that the nose maybe cannot make naturally. So usually the rule of thumb is 3 to 4 times a day, but if you're outside and you've been in a dusty environment, then using it more, you know, when you come in to help rinse some of that out is certainly doable.
Okay. All right, we've covered a lot of topics tonight. We have about 10 minutes left in the show, so if you're sitting there thinking, I don't know if I need to ask this or not, you've got about 10 minutes left. Feel free to call us and we'll get your questions answered. I appreciate the answers that you've given us tonight. What have we not covered that maybe you get asked a lot, either one of you, in your office? So patients come in, maybe some common questions, different things we haven't covered.
Well, the sinus thing was one that that really stood out for me. The other is I guess the difference between what an ear infection is as opposed to an outer ear infection and a middle ear infection. The outer ear infection is a swimmer's ear. When people come into the office, they'll say, well, I was told I have an ear infection. Well, if we're talking about a swimmer's ear type of an ear infection, the treatment is going to be different than if we're having somebody having trouble with repeated infection in the middle ear space on the other side of the eardrum. So that's a really important distinction that people should be aware of.
Okay. Can you think of anything that we haven't covered yet that you get asked a lot about?
I'm drawing a blank.
Drawing a blank? That's okay, because I have another question.
Okay, good.
We've talked about the ears a lot, the nose a lot, and you cover the throat as well. So what's some different things maybe that people come in to see you about that have to do with the throat?
Well, swallowing is one.
Okay.
Then sometimes people have some difficulty with swallowing. We deal with that's called dysphagia. We deal with that, and there are multiple causes of that as well. Oftentimes people will say, I have this little lump in my throat. It feels like I've got something and I'm trying to swallow it and it won't go down and it won't come up. And really what they're experiencing is something called globus, and that's a swelling of the tissue right where the food goes into the esophagus. Oftentimes that's from reflux. People will have trouble with either a lot of belching, or they'll have heartburn, or they'll bring up some fluid into their mouth from their stomach, kind of a sour taste. And that is an acidic fluid and causes some irritation to the very delicate tissues that's not supposed to see acid, and it'll become swollen, and you can have trouble swallowing because of that. The voice is another big area. I think the number one recommendation I have for people is make sure you drink plenty of water, because that takes care of a whole lot of what we deal with.
Isn't it amazing what water can do?
I know, it's
not soda, not
water. Water.
Yes.
Stay hydrated.
Stay hydrated. Yeah. Mm-hmm. Yep.
Well, I've had 2 questions come in, well, 3 now, and 2 of them are about neti pots. Are they safe to use? And just wondering what your thoughts on them are.
Neti pots are wonderful. I don't necessarily like the little blue pot, because you have to kind of stand on your head and get into all these positions in order to get the fluid to go where you want it to. They do make some bottles that are the same volume as the neti pot, and you can do them standing up. Someone who has trouble with chronic sinusitis, if you can get yourself into the habit of doing that, that is one of the best things you can do in order to help with sinusitis. It is important that you don't use tap water. You need to use either distilled or filtered water.
Okay.
They are safe to use if you take those precautions and you make sure that you clean out your bottle or neti pot frequently, so that you don't harbor any bacteria in there. But they can really help somebody who has a chronic problem.
Okay. Are sinus infections contagious?
Well, I guess they would be if you weren't careful about how if you had sneezing, or if you have discharge and you're leaving your tissues laying around. So, yes, I would imagine that someone could catch that.
Okay. Yeah. So just be careful, wash your hands.
Yeah, mm-hmm, yes.
Keep things sprayed.
Yeah. Throw your tissues in the
Right,
garbage.
throw your tissues away. June in Charleston would like to know what she can do about her nose dripping and clearing her throat throughout the day.
See her family physician, because there are multiple reasons why that can happen. If this has been going on for a while, somebody should be evaluating her.
What would be causing that, do you think?
Well, there's multiple reasons. I don't know how old she is. Sometimes age can cause nasal discharge. As we get older, you said before, things don't work like they used to. Well, the nose is the same thing.
Yeah.
The nerves control the mucus in our nose, and as we get older, sometimes the signals are not as strong as they used to be, or as accurate. And so you may have a runny nose when you shouldn't, like when you eat, or a change in temperature or physical activity have a significant drainage from your nose. That would be different than somebody who has allergies, or someone who might be affected by just particles. People come into the office all the time and say, I'm allergic to perfume, or I'm allergic to smoke. Well, it may not be an allergy. There's a difference between irritation and allergy. So it really, there's no one answer that I can give to say that that's what's causing it. And as far as clearing the throat, that can be reflux. It can be not hydrating well.
A number of different things.
Yes, it can be a mass lesion, a tumor. It can be many things.
Right, and let's hope not. Let's hope it's
Spicy
something minor.
Well, spicy food, right?
Okay.
Yeah.
We were talking before the program started, and I wanted to get some information out. There's a head and neck cancer screening offered in April, and there's information that folks can get to. Can you just talk a few seconds about that, and where they can go get more information about that?
Absolutely. Every April there is Head Neck Cancer Awareness Week, and one of the things that we do is a free head and neck cancer screening. And that is, it's not to replace an examination at a physician's office if you're having problems. What it is to help to screen for the possibility of head and neck cancer. and that includes tongue cancer, lip cancer, throat cancer, cancer of the vocal cords, those types of things. That cancer is often caused by tobacco use, and that can be chewing tobacco or smoking tobacco. There is also one of the up and coming causes of head and neck cancer is a virus, same virus that causes cervical cancer in women. And so it's very important to make sure that your children are vaccinated for this cancer, not to just protect the girls now, but also the boys are seeing an increase in cancer as they get older because of this virus.
Okay.
And so the screening is just to raise awareness.
Raise awareness.
Of head and neck cancer and what can be done to prevent it.
And this is coming our way in April, the beginning of April. And for more information, viewers can go to sarahbush.org.
Yes, to our website, and there should be some information on the website that they could access.
All right, and both of your offices are located at Sarah Bush in Mattoon, is that correct? We had another question come in.
Yes.
Yeah.
We're on the 4th floor.
All right, the 4th floor. Well, we've covered lots of things. We're almost out of time here. Is there anything else we'd like to mention before we close the show?
Thank you for letting us do
Well,
this.
thank you. It's been a pleasure talking with you. It's been a pleasure. Thank you for being on the show tonight. And thank you to all of you for tuning in for this live special edition of Being Well. Once again, this was Dr. Lori Cudone, an ENT physician with Sarah Bush, and Dr. Jennifer Shunk, an audiologist with Sarah Bush. We'd like to thank Sarah Bush as well for helping get the word out about all different things to do with ear, nose, and throat and allergies. And we'd like to thank you for watching tonight and tuning in. You can catch us on YouTube at your convenience. Have a nice evening.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.